Okay, good afternoon, everybody. Am I audible?
Yes, ma'am.
Okay. We shall start with the topic chemical and food poisons. So, these are the learning objectives. At the end of the class, BSc Nursing third year students should be able to firstly define a corrosive poison. Secondly, describe clinical features and treatment of sulfuric acid poisoning. Thirdly, describe clinical features and treatment of phenol poisoning. And fourthly, discuss symptoms, laboratory diagnosis, and treatment of mushroom poisoning. Okay, so let us start with the definition of a corrosive poison. Okay, so a corrosive poison is a substance which erodes and destroys any surface it comes in contact with. So the typical example are strong acids and alkalis. And I mentioned sulfuric acid, nitric acid, and concentrated hydrochloric acid. So the mechanism of action, it extracts water from tissues. When the acid comes in contact, when a strong acid comes in contact with the body, it acts by extracting water from the tissues. And it coagulates the cellular proteins and converts hemoglobin to acid hematin. So this is the mechanism of action of caustics or strong acids and alkalis. They are called corrosives because they erode and destroy any surface they come in contact with. You can see the picture there, how the acid has made a hole in the cloth. Okay, this is the destructive effect of an acid. It burns or corrodes. So the classification, mineral acids, organic acids, and alkalis. So in clinical practice, most often than not, we come across sulfuric acid poisoning, carbolic acid, which is also called phenol. The others are not very commonly encountered in clinical practice. So let us start with sulfuric acid, which is also called oil of vitriol. It is a heavy, oily, colorless, odorless, and non-fuming liquid. It is used in storage batteries, car batteries. Use sulfuric acid. Pipe and drain cleaners, and in the laboratory and industry. So the destructive effect will depend on the concentration of the acid. A dilute acid can also cause harmful effects, but the effects are less damaging. Clinical features, if it comes in contact with the skin, it can cause brown eschars or brown lesions around the lips, mouth, and chin. If a person has tried to commit suicide by ingesting sulfuric acid, or it could be purely accidental, because sulfuric acid is similar to castor oil. Okay, it looks like castor oil. If the bottle is not labeled properly, a person may consume sulfuric acid thinking that it is any other liquid. So that can cause a damaging effect. Then when the liquid enters, when the acid enters the esophagus, there is a severe burning pain in the mouth, throat, and chest, retrosternal pain. And when it trickles down to the stomach, it can cause epigastric pain and difficulty in swallowing because of the corrosive effect. Teeth may become chalky white. So studies have been done, where they studied these industrial workers who worked in battery making factories. So it was found that, with prolonged exposure, the teeth were eroded. Prolonged exposure to sulfuric acid can cause erosion of the teeth. Then vomiting, diarrhea, and shock. Difficulty in breathing, cough, and glottic edema. These are all, the irritative effect of sulfuric acid. And if the acid is very concentrated, it can cause perforation of the esophageal and gastric mucosa, strictures in the esophagus, and infection. The fatal dose is around 10 to 15 ml of concentrated sulfuric acid. So the treatment, coming to the treatment, there is, the immediate treatment of first aid and long-term treatment if the patient survives. What is the long-term treatment? So the treatment discussed here is the immediate treatment of first aid that you give in a case of sulfuric acid poisoning. Stomach wash is contraindicated. I put a cross there. Okay, it is contraindicated. Can you tell me why? Can someone tell me why? Why is stomach wash contraindicated in sulfuric acid poisoning? Okay, why is stomach wash contraindicated in sulfuric acid poisoning? What happens when you pass a tube? When you pass a tube? Yes?
Maybe it might burn the soft tissue in esophagus.
So it can cause perforation because the mucosa is already softened. Okay, it is already eroded. And it becomes very thin. So, thin and softened. So, passing a tube can cause perforation of the mucosa. It can perforate the mucosa. So, that is why stomach wash is contraindicated in corrosive acid poisoning. In a case of acute poisoning, you can give demulcents like milk of magnesia and condensed milk. These have a kind of a soothing effect on the mucosa. Crushed ice can also be given to relieve thirst. If there is severe pain, a strong analgesic may be required to relieve the pain. That burning sensation and pain which is caused due to ingestion of the acid. Antibiotics can also be given, but only if there is infection. IV fluids and nil per oral, nil by mouth. So care can be taken to maintain the airway. And skin lesions, if the acid comes in contact with the skin, this acid should be washed off with soap and water, with soapy water. And if acid has got into the eyes, it can be washed with copious amounts of water. So this is the immediate first aid treatment of sulfuric acid poisoning. Then in the long term, a chest X-ray can be done. X-ray of abdomen to rule out aspiration and visceral perforation. Esophagoscopy can be done within 12 to 24 hours to assess the extent and severity of burns. So usually flexible fiber optic endoscopy is done in such cases to assess the extent of internal damage. Or sometimes, when the damaging effects extend to the esophagus and stomach, a laparotomy may be required, exploratory laparotomy may be required, and surgical intervention like removal of the damaged part may be required, partial gastrectomy may be required to remove the damaged area. So you can see here in this picture, can you see the corrosive effect of the acid? Brownish eschars around the mouth. You see here because of the trickling effect, the acid trickles, downward towards the throat and chest. So you can see these grayish areas here due to contact with the acid. So what is the medical legal importance of sulfuric acid? Ingestion of sulfuric acid may be purely accidental because the acid can be mistaken for glycerine or castor oil. So the precaution that we must take is to label all bottles properly. If it is sulfuric acid, concentrated sulfuric acid, you should label it, okay? Whether it's dilute or concentrated or the percentage, okay? Whether it's, 10% or 50% concentrated, that should be labeled properly and stored properly also. Keep out of reach of children. Store these containers properly in a shelf reserved for that purpose. So, poisoning can also be suicidal, but it is very rare. Okay, consumption of battery acid with suicidal intent. But it is rare because it is very painful. Okay, swallowing acid is very, very painful. So, suicidal poisoning is rare. Homicidal poisoning also occurs, but it is extremely rare. Then there is a condition called vitriolage. Vitriolage is throwing off acid intentionally on a person. You must have come across, the newspapers, cases of acid attacks. A person, a boy is interested in a girl and she rejects his advances. So to take revenge, he throws acid on her face. Okay, and this causes a destructive effect. It distorts her face. Okay, that is called vitriolage. The willful and intentional throwing of acid on a person with intention to maim or distort. Okay, so this is called vitriolage. This is a punishable offense. And sulfuric acid has also been used in the past for disposing a dead body. A dead body, is eaten up or corroded by the acid. So, acid has been used in the past to dispose of a dead body. So, this is an acid attack, okay, vitriol throwing. It is a criminal offense punishable under section 320 of the Indian Penal Code. It is considered as a grievous hurt. And also punishable under sections of 326A and 326B of the Indian Penal Code. So you can see here the destructive or damaging effects of the acid. But now it is a punishable offense in India. Now we come to phenol or carbolic acid. This is also a corrosive. Okay, phenol is also a corrosive, but the corrosive effect will depend on the strength or the concentration of phenol. If it is very dilute, like what is used in, as a disinfectant in hospitals and homes, that is not very harmful because it is dilute. But, the concentrated form is a corrosive. So phenol is seen as colorless needle-like crystals. You can see over here, colorless needle-like crystals which turn pink and liquefy when exposed to air. So these are phenol crystals. But what we see, commercial phenol is a brown liquid, a brownish liquid with a characteristic phenolic odor, which we are all familiar with because it is used as a disinfectant and a floor cleaner. So you can see over here the uses of phenol: disinfectant, preservation of vaccines and sera. It has medicinal uses. It is used in industries, and its derivatives find many uses in laboratory and industry. Cresol, coal tar, thymol, menthol, and tannic acid. These are all derivatives of phenol. So phenol is rapidly absorbed from the skin and mucous membrane. And locally, when it comes into contact with skin and mucous membrane, it acts as a corrosive. It corrodes or destroys the surface it comes in contact with. But there is little pain because the nerve endings are damaged. The pain fibers, nerve endings are damaged. So there is little pain. It acts by precipitating protein and coagulates cell contents. So there is necrosis of tissue, sloughing and formation of white eschars. So you can see over here, case of phenol poisoning, you can see, okay, the brownish stains around the mouth and the lower part of the face due to contact with phenol. So the clinical features of phenol poisoning: headache, vertigo, tinnitus, vomiting, diarrhea and abdominal pain. On examination, the pulse is thready. It means it is barely felt. There is profuse sweating. The skin is cold and clammy. And ultimately the patient goes into shock and there is metabolic acidosis. Phenol is a hepatotoxin. It causes hepatic and renal damage and abnormal liver function tests. Abnormal liver function tests. There is carboluria, that means excretion of these phenolic metabolites in urine, and methemoglobinemia. And ultimately there may be death from respiratory or circulatory failure. The fatal dose is 10 to 15 grams or milliliters. So what is carboluria? We mentioned carboluria as one of the symptoms of one of the clinical features of phenol poisoning, isn't it? So what is this carboluria? It is the excretion of phenolic metabolites in urine. So the urine becomes scanty, dark colored and smoky green on standing. And this is because of the presence of hydroquinone and pyrocatechol, which are metabolites of phenol. Phenol is converted into these two metabolites in the body. Is it clear so far?
Yes, ma'am.
So let us move on. Treatment of phenol poisoning. So phenol,
Yes, ma'am.
yes. Phenol, although it is a corrosive, usually stomach wash is contraindicated in corrosive poisoning. But phenol is an exception. Please remember. Phenol, although it is a corrosive, stomach wash can safely be used in phenol poisoning. Because phenol, when it comes into contact with the mucosa, it hardens the mucosa. It does not cause softening, rather it causes hardening of the mucosa. So, stomach wash can safely be done in phenol poisoning. It is an exception because usually in corrosive acid poisoning, you cannot do a gastric lavage, you cannot do a stomach wash. But phenol is an exception. Please keep this in mind. Stomach wash, and then you can use activated charcoal, demulsants. Okay, demulsants are, something soothing. As was mentioned earlier, milk of magnesia or condensed milk. A soothing liquid which can be given orally because of the soothing effect. So if phenol has come in contact with the skin lesions can be washed copiously with water. And sodium bicarbonate can be given intravenously. If there is methemoglobinemia, methylene blue can be administered. If there is renal failure, hemodialysis can be started. And the rest of the treatment consists of supportive measures. Okay, like I mentioned in general principles and management of poisoning, symptomatic and supportive measures are the mainstay of treatment because antidotes are not available for all kinds of poisons. So, the mainstay of treatment are supportive measures, and here nurses play a very important role. So, post-mortem findings: if a person dies because of phenol poisoning, what are the findings when you examine the dead body? So there are corroded areas of skin and mucous membrane, as you can see here, corroded areas of skin, brownish eschars. A characteristic odor, the odor of phenol, smell of phenol. The stomach mucosa is pale and hardened. There may be cerebral and pulmonary edema and congestion of viscera. Then medical legal importance of phenol. Medical legal importance of carbolic acid poisoning. So carbolic acid is another name for phenol. It's the same thing, phenol or carbolic acid. So most cases of poisoning are accidental. Suicidal poisoning is quite rare, and homicide is very rare. Poisoning with phenolic derivatives, as mentioned earlier, thymol, coal tar, it can cause similar but less serious symptoms. Is it clear so far?
Yes, ma'am.
Can somebody tell me what poisons we have discussed so far?
Ma'am, sulfuric acid and carbolic acid.
Okay, sulfuric acid and carbolic acid. Where can you use gastric lavage?
In carbolic acid.
Yes. Sulfuric acid, will you use gastric lavage? Yes or no?
No, ma'am.
No. Okay.
No.
Okay, now we come to chronic phenol poisoning. Sometimes there may be chronic exposure to phenol, like in laboratory workers or industrial workers or even people working in healthcare centers, because phenol is used as a disinfectant. Prolonged and chronic exposure to phenol can cause a condition known as phenolic marasmus. This is characterized by anorexia or loss of appetite, headache, loss of weight, dark urine, and ochronosis. So what is ochronosis? Ochronosis is deposition of phenolic metabolites in the skin. You can see here brownish deposits, okay, of phenolic metabolites in the skin, sclera, you can see over here, brownish, okay. Cartilage and ligaments causing dark pigmentation of the skin and sclera due to deposition of phenolic metabolites on long-term exposure. So now we come to organophosphorus compounds. Have you heard of organophosphorus compounds?
Yes, ma'am.
Yes, ma'am.
Yes. Have you heard of organophosphates? Organophosphorus compounds. What are they used as?
No, ma'am.
No. Okay, they are used as insecticides or pesticides. Okay, they are used as pesticides. Okay, usually in agriculture. They are used by farmers because, when farmers grow crops, these crops are attacked by pests or insects. So these pesticides are used to kill the pests or insects so that the crops can grow properly. Okay, is it clear? So there are different categories.
Yes, ma'am.
Yeah. So there are different categories of these organophosphorus compounds. The extremely toxic ones, moderately toxic, malathion and temophos. So most of them are used as insecticides or pesticides. And some are used as nerve gases. The mode of action is inhibition of the enzyme acetylcholine esterase. Fatal dose is 1 gram of malathion. Malathion is the standard. So 1 gram of malathion is fatal. So clinical features are, last week we had discussed toxidromes. So can you tell me what toxidrome this is? The clinical features fit into which toxidrome? Is it the anticholinergic, cholinergic, sedative, hypnotic? Can you see the screen? What kind of symptoms are these? Anybody? So cholinergic symptoms, okay? Cholinergic symptoms. So muscarinic effects like salivation, lacrimation, sweating, cough, wheezing, dyspnea, pulmonary edema, diarrhea and meiosis or constriction of the pupil. And nicotinic effects like twitching, fasciculations and weakness of muscles. And there are also central effects, central nervous system effects, like excitement, ataxia, convulsions, coma and death. So most of these pesticides, they have a kerosene-like or garlicky odor. Kerosene-like or garlicky odor. Cholinergic effects. And chronic poisoning. Chronic poisoning can occur in agricultural workers who are engaged in spraying of crops through inhalation or skin contamination. Farmers working in the fields. So they often use these insecticides to spray to spray on the crops. Okay, so these insecticides act by killing the pests or insects so that the crops can grow properly. But the side effect of spending such a long time in the fields exposed to all these chemicals has a damaging effect on the central nervous system. It can cause paresthesia, muscle cramps, drowsiness, anxiety. These are the long-term effects of organophosphorus compounds. So when farmers are using these insecticides in the fields, they are advised to wear protective clothing. You can see here most of our farmers, because we are a low resource country, they may not have protective equipment to wear. They work in such conditions, you see, exposed to chemicals, but they have no protective gear or protective clothing. While if you see abroad, those engaged in such activities usually have protective clothing. Here the only protective thing is a mask. Okay, but they should be wearing something like a PPE. Okay, to protect themselves from the harmful effects of these chemicals. So the diagnosis of organophosphorus poisoning, history of exposure. Okay, usually from the occupation of the person. He says he's a farmer or agricultural worker engaged in spraying of crops. And there is a high risk of exposure to organophosphorus compounds. Then the typical symptomatology, the cholinergic symptoms, okay, constriction of the pupils, vomiting, diarrhea, increased bronchial secretions. Then laboratory diagnosis of RBC choline esterase. So plasma and RBC choline esterase levels fall. And there is presence of p-nitrophenol in urine. This is a metabolite of these organophosphorus compounds. So this is present, this can be detected in the urine in cases of poisoning. So treatment, the immediate treatment, if a person is acutely poisoned, maintain the airway, breathing and circulation. Remove the contaminated clothing. Frequent suction, that means suction, you're taking out the secretions which are blocking the airway. This of course has to be done in a medical center. Endotracheal intubation and assisted ventilation. Stomach wash if the exposure has occurred within the last 6 hours. Wash contaminated skin and eyes. Activated charcoal can be given in the usual doses. So here the antidote available is atropine. Atropine is an anticholinergic. So it helps to control the excessive secretions. It can be given at a dose of 2 to 4 milligrams every 15 minutes till the pupils dilate. Pralidoxime is another antidote. It can be given at a dose of 1 gram intravenously 8 hourly. And if there are convulsions, diazepam, which is a sedative, can be given intravenously. So the medico-legal importance of organophosphorus compounds. It is a common suicidal poison in India, especially among farmers. You have heard of farmer suicides taking place in India. Farmers are depressed because of crop failure. So they commit suicide, and this is easily available. And it is accessible because they use them in the fields. So it is a very common suicidal poison in India. Poisoning can also be accidental due to occupational exposure. Someone who is working in the fields, in the agricultural sector, chronically exposed to this poison. Poisoning has occurred in the past due to contamination of foodstuff. Actually, food was not stored properly. This Kerala food poisoning incident of 1958, it was very tragic. These organophosphorus compounds, these pesticides were stored in the same place as food. So the food got contaminated, and people, on consuming this food became seriously poisoned, and they were taken to the hospital. Many of them died. So this was something very serious. So we have to take proper care to store these chemicals properly, label them, and they have to be kept in a separate compartment altogether. They should not be mixed with food. Now we come to mushroom poisoning. So in last week's chart, I had shown the incidence of poisoning in NEIGHRIMS. Do you remember how many cases of poisoning there were? In a single year, 2015, yes? How many cases of poisoning did we have according to that chart? Anybody remembers?
12.
12, very right, very true. Yes, you're right. Okay. So, 12 cases of poisoning in the year 2015 alone. So, this is something very serious, and there were casualties also. 2 or 3 of the patients lost their lives due to mushroom poisoning. So, this is something that we should be aware of. So, the common species, poisonous species of mushroom are Amanita phalloides and Amanita muscaria. This Amanita genus accounts for 95% of deaths from mushroom toxicity. What are the toxins present in poisonous mushrooms? Now see, not all mushrooms are poisonous. How many of you are fond of eating mushrooms? A good number, isn't it? I also like mushrooms a lot. But we should distinguish between the poisonous and the edible mushrooms. Okay, edible and non-edible, poisonous, non-poisonous. So some mushrooms are safe to be eaten, but some are very poisonous. So the toxins present in these poisonous mushrooms are amatoxin, phalloidin and virotoxin. And they act by causing cell necrosis in the liver and kidney. They are hepatotoxic and nephrotoxic. The fatal dose is 5 to 7 milligrams of amatoxin. That is, consumption of 1 to 2 mushrooms can lead to death. So how do you distinguish poisonous from non-poisonous? So this is just in general. Amanita phalloides, this poisonous species, has an olive green cap. You can see in this picture, olive green cap. Okay, so this looks very attractive, no doubt, but it is highly poisonous. It's called a death cap. It has an olive green cap, white gills. These are the gills. You can see over here the gills on the undersurface of the cap. A ring around the stalk. Okay, you can see here the ring, annulus. A cup or vulva at the bottom of the stalk. This is the vulva or cup. And white spores. If you shake the mushroom from the undersurface, many spores will come out. So toxic mushrooms usually have a bitter, astringent or acid or salt taste. But we should not test toxicity by tasting. This could be fatal. Okay, this could be dangerous or even fatal. If you cut the mushroom, the cut section turns brown, green or blue on exposure to air. If you cut a poisonous mushroom, the cut section turns brown, green or blue on exposure to air. So this is a very crude way of finding out. Of course, there are laboratory tests also, to test the toxicity. But this is a crude way, on physical examination, how you will distinguish poisonous from non-poisonous mushroom. So, clinical features of Amanita phalloides poisoning. Okay, here we're talking about the species Amanita phalloides. So, the incubation period is around 6 to 12 hours. Okay, the signs and symptoms will start after 6 to 12 hours of consumption of mushroom. So, to start with, there may be cholera-like diarrhea, profuse diarrhea and abdominal pain, constant vomiting and fever. Then the patient recovers. There is a latent stage for a period of 2 to 3 days, and this can be very deceptive. Because sometimes at hospital, nurses and doctors attending the patient, they think that the patient has improved. But this is, actually a latent stage. And after the third day, the symptoms can return. More serious symptoms return. Patient may come, in a state of, in a jaundice state, yellowish discoloration of the sclera, delirium, confusion, metabolic acidosis, renal failure and coma. So, this can be followed by death in 5 to 10 days. So we have to be aware about this latent stage and just observe the patient. Even after patient recovers after a day or two, we should be careful. Just keep the patient under observation. Don't discharge the patient yet, because the patient has to be observed. The symptoms can return at a later stage. Diagnosis. This is the laboratory diagnosis. Meissner test. So Meissner test is a very simple test to test the toxicity of a mushroom. So you squeeze some juice out of the mushroom. Of course, in the lab you'll be using gloves and mask, isn't it? So squeeze the juice from a poisonous mushroom onto a newspaper. And the other circle is a control. Okay, maybe just plain water or distilled water or normal saline. Then you add a few drops of concentrated hydrochloric acid to both. Okay. And the one which has the poisonous mushroom extract will turn blue when you add concentrated hydrochloric acid. And the control will remain colorless. So this is a test, a laboratory test, simple spot test which you can do to see if a mushroom is poisonous or not. Then there is a test called TLC or thin layer chromatography, which is done in the laboratory. Radioimmunoassay and spore reaction with Melzer's reagent. This can be done. This is also a kind of a spot test. Okay, what you do is you shake the spores from the cap of a mushroom. Shake the spores onto a paper or onto a slide and add a few drops of Melzer's reagent. This Melzer's reagent contains iodine, potassium iodide, chloral hydrate and water. It is a solution. Melzer's reagent. Add a few drops of Melzer's reagent to the spores on a slide or on a piece of paper. And allow the reaction to take place for maybe 20 minutes or half an hour. Then observe under the microscope. If the reaction is, dark, you can see over here blackish particles or dark brown, it is a positive reaction. It is a poisonous mushroom. Okay, so this is called spore reaction with Melzer's reagent. Is it clear?
Yes, ma'am.
Okay. Now let's move on to the treatment. So stomach wash can be done in mushroom poisoning. Activated charcoal can be used. Maintain the fluid and electrolyte balance. Atropine can be given in early mushroom poisoning. In Amanita phthaloids poisoning. Atropine can be given only in the early stages. Okay. Because of its anti-muscarinic effect. Okay, so Amanita phthaloids causes cholinergic effects. Okay, Amanita phthaloids causes cholinergic effects. So atropine can be used in the early stages to counteract, because atropine is an anticholinergic. So it can be used to counteract the early features of Amanita poisoning. So there are some treatments which have been proven to be beneficial in mushroom poisoning. One is silymarin. So silymarin is derived or is an extract of this plant, milk thistle plant. Silymarin is an extract from the milk thistle plant. So this is found to be beneficial in mushroom poisoning. It is available as capsules, as a suspension, or even as a powder. Silymarin extract. So it can be given at a dose of 1 gram orally 4 times a day. And it can be, silibinin. Silibinin again is derived from silymarin. Silibinin is derived from silymarin. So this can be given as an infusion, IV infusion, over a period of 24 hours. So these have been proven to be effective in mushroom poisoning, silymarin and psilocybin. It is an extract of the milk thistle plant. So other treatments which can be beneficial are benzyl penicillin intravenously, vitamin C, N-acetylcysteine. So how do all these agents act? Actually, they are hepatoprotective. They prevent the uptake of amatoxin into the liver cells. They prevent the uptake of amatoxin into the liver cells. That is how they act. And some of them, like vitamin C, have an antioxidant property. Then long-term charcoal hemoperfusion and hemodialysis can also be used to eliminate the poison, the toxin. And if the patient survives the initial insult, then ongoing patient care, round-the-clock patient care, and management of complications is important. Okay. So is this clear regarding treatment of mushroom poisoning? Is it clear?
Yes, ma'am.
Okay. So just to summarize, what have we learned today? Can you name the poisons and clinical features and treatment? Okay, just tell me about the poisons that we have learned about today. One of you can just summarize.
Sulfuric acid,
Yes, sulfuric acid.
carbolic acid,
Yes. Yes, carbolic acid or phenol and?
organophosphorus compound,
Yes.
and mushroom poisoning.
Okay. So I hope we have fulfilled today's learning objectives, which we learned at the beginning. Okay, can you now define a corrosive? Can you define a corrosive poison? What is a corrosive poison?
Ma'am, a substance which erodes and destroys any surface it comes in contact with.
Yes. So can you give an example of a corrosive poison?
And sulfuric acid,
Yes, strong acids and alkalis. Strong acids and alkalis. So phenol is also a corrosive. Okay, phenol is also a corrosive poison. Okay, is it clear? Do you have any doubts? Would you like to ask anything?
Ma'am,
Yes.
ma'am, for the treatment of sulfuric acid poisoning, it is asked for the nil per mouth, but then there is also this that crushed ice to relieve thirst.
That is the initial phase. Okay, you don't give any food. Okay, you don't give any food. Nil for oral means you don't give any food. Okay, but that crushed ice is at the initial phase only, just to relieve the pain and that burning sensation. Okay?
Okay, ma'am.
Yes. Anything else? So if there are no other doubts, we shall conclude today's class. Thank you for your patient listening. And please read up whatever. Yes? Anybody wants to say something?
Ma'am,
Yes.
ma'am, those who are patient who is having mushroom poison, no?
Yes.
If a prognosis for them to survive, ma'am, or they will die only.
Well, it depends. It depends on how much of that mushroom they have eaten. No, we said the fetal dose is 1 to 2 mushrooms. So it depends of how on how much they have eaten, how soon they come to hospital. Sometimes people from the villages reach hospital very late, and by the time they they come to hospital, they are already in that advanced stage. So it depends, what stage they come to hospital and whether the treatment is given. Remember the golden hour of poisoning or injury. The earlier the patient gets medical treatment, the better the prognosis. Okay. So, yes. But if the patient has taken a very, high dose, like, a large amount of the poisonous mushroom, then the prognosis will not be very good. And then other factors like, individual resistance to the poison, each person's system works differently, isn't it? Okay. Sometimes the body fights back, but sometimes, they succumb. They give in. If a person is already weak and already suffering from some other condition, then, the prognosis will not be so good, isn't it? Okay. So other medical conditions, other pre-existing, morbidities or other clinical conditions will determine what the person's state of health. If a person is already weak and frail, then the prognosis will not be so good. Is it clear?
Yes, ma'am.
Okay. Anybody else?
Ma'am.
Yes.
Ma'am. If anyone have mushroom poisoning in village,
Yeah.
so is there any emergency treatment we can give at home, like home remedy before reaching to the
Maybe you
hospital?
can induce vomiting at home. Yeah, maybe you can induce vomiting. But then if you are very sure that it is a poisonous mushroom, then better take the person to the nearest health center. Okay, better take the person to the nearest health center. That is the only way. Because poisonous mushroom, if the poison is already absorbed into the system, and there's not much you can do at home except try to induce vomiting. And if poison is already absorbed, it will have damaging effects on the, on the system, isn't it? Okay. So the earlier the person reaches hospital, the better it is. Are there any other questions, or can I conclude the class?
No questions, ma'am.
Okay. Okay, thank you very much. Thank you very much.